He seemed like the perfect doctor, friendly, polite, and always willing to listen. People trusted him completely. For many elderly patients, he was more than a doctor. He was a companion, someone they could confide in. Families praised his dedication, and neighbors admired his professionalism. To anyone who met him, Harold Shipman appeared ordinary, even admirable. But behind this calm, reassuring demeanor, there was a darker truth. Harold Shipman, a general practitioner in England, would go on to become one of the most notorious serial killers in modern history. Shipman's victims were mostly elderly women, living alone and vulnerable. They adored him and never suspected that he could cause them harm. Even when some people noticed unusually high death rates among his patients, most of the community remained loyal. No one imagined that a man who seemed so ordinary, so integrated into society, could be capable of such crimes. Shipman's crimes were hidden behind his charm, professionalism, and carefully constructed image of trustworthiness. The exact number of people Shipman killed may never be known. Estimates suggest over 200 patients died at his hands over 3 decades. This staggering figure surpasses almost every other serial killer in recorded history. What made him so terrifying was how ordinary he appeared. Shipman blended seamlessly into his community, maintaining a facade of normality that allowed him to continue killing without suspicion. He was a master manipulator, exploiting the trust placed in him by patients, families, and even colleagues. His first real breakthrough came with the death of Kathleen Grundy, a local pensioner and former mayor. She had recently changed her will to favor Shipman, which raised suspicions within her family. Her daughter noticed irregularities and demanded an investigation. Grundy's body was exhumed, and forensic tests revealed lethal amounts of morphine, far more than needed for pain relief. She hadn't been seriously ill, making it clear that Shipman had killed her. This discovery marked the beginning of uncovering the horrifying scale of his crimes. Shipman's method was consistent and chilling. He would administer lethal doses of morphine, often when patients were alone or resting at home. He then manipulated medical records to suggest the patient had been ill for a long time. Many victims were found fully dressed, seated in chairs or on sofas, giving the impression of a peaceful, natural death. Publicly, Shipman appeared devoted and caring, but in private, he controlled life and death with terrifying precision. To understand how Shipman became a killer, we need to look at his early life. Born in 1946 in Nottingham, England, he grew up in a working-class family. As a child, he was distant, quiet, and reserved, often keeping to himself. His mother placed immense pressure on him, encouraging academic success while limiting his social and emotional growth. Some experts believe this created in him fantasies of power and control, shaping the man he would later become. The death of his mother when Shipman was just 17 had a profound effect. She died of lung cancer, and he was present at her bedside, administering morphine as she passed. Some believe this early experience linked morphine with power, control, and a sense of authority over life and death, an association that may have influenced his later crimes. Shipman himself never fully explained his motives, but the connection between that moment and his future killings is chilling. Shipman struggled academically in his early years, but eventually entered Leeds Medical School. During his time there, he showed signs of recklessness, including early drug use and turbulent relationships. After graduating, he began practicing medicine in Todmorden and later in Hyde, Greater Manchester. Although details are unclear, it's possible he committed his first murders during these early years, but they went unnoticed due to the trust placed in him and the lack of stringent medical oversight. In his professional life, Shipman was meticulous, insisting on controlling every aspect of patient care. He frequently administered injections himself and kept strict control over medical procedures. Colleagues noticed his intense focus, which sometimes bordered on obsessive. Behind closed doors, however, he also developed an addiction to drugs like pethidine, using them to maintain energy and focus. Despite these issues, Shipman remained popular and respected, trusted implicitly by patients and peers alike. Shipman's practice in Hyde was the perfect setting for his crimes. He worked alone, controlled patient interactions, and was deeply trusted by the community. His victims were often elderly and isolated, less likely to raise suspicion if they died suddenly. He manipulated medical records, forged documents, and sometimes encouraged cremation to erase evidence. Over decades, this methodical approach allowed him to kill hundreds without immediate detection. Many people eventually began to notice patterns. The death rate of Shipman's patients was unusually high. Many elderly women died suddenly, often after visits from him. While some colleagues raised concerns, their warnings were often dismissed. Families were confused by the sudden deaths, and the local community remained largely unaware of the sinister reality. It wasn't until Kathleen Grundy's suspicious death that authorities could act decisively. Forensic testing and careful investigation finally revealed the horrifying truth. Shipman was responsible for a staggering number of deaths. Shipman's motivations remain partly mysterious. Some experts believe he resented older women or sought to recreate the sense of control he felt during his mother's death. Others suggest he experienced a perverse thrill from administering lethal doses, combining power, authority, and a sense of satisfaction. His lack of empathy and ability to objectify his victims allowed him to carry out these crimes for decades. For Shipman, murder may have become routine, a way to assert dominance over life and death, and to manipulate those around him without fear of discovery. Even after his arrest and conviction, Shipman never admitted guilt. He corresponded from prison, maintaining an appearance of normality. On January 13, 2004, he took his own life in his cell. Shipman's suicide denied the victims' families the chance for full closure, leaving them with grief, shock, and unanswered questions. His death also prevented further insights into his motivations, which remain partly mysterious. Shipman's case remains one of the most chilling examples of a serial killer hiding in plain sight. He exploited trust, manipulated environments, and preyed on vulnerable people. His story is a warning that appearances can be deceiving, and even those who seem ordinary may conceal unimaginable darkness. Shipman's crimes left a lasting impact on medicine and law enforcement in the UK, forcing reforms and stricter monitoring of medical practices to prevent a tragedy of similar scale from happening again. Ultimately, Harold Shipman's story is one of deception, control, and the darkest aspects of human behavior. He was a doctor, a trusted member of the community, and someone who appeared ordinary to everyone around him. Yet beneath that ordinary facade was a calculating killer who manipulated life and death for decades. His story continues to fascinate, horrify, and serve as a reminder of the complexity of human nature, the dangers of blind trust, and the importance of vigilance. If you found this story as chilling and fascinating as we did, make sure to subscribe to the channel for more incredible true crime documentaries. Every week, we explore stories that shock, inspire, and leave you thinking.